So, hey everyone, I am Bianca B. Cortes and I'll be going to perform a head-to-toe assessment. So, let's define first what is a head-to-toe assessment. So, it refers to a physical examination or health assessment, and it becomes one of the many components of the understanding a patient needs and problems. So, first thing we should do is we're going to perform hand hygiene, and we're going to provide privacy to the patient, and let's introduce ourselves to him or to her and explain what are we going to do today. So, hello, I am Bianca and I'll be your nurse today, and we're going to perform head-to-toe assessment. Is that okay with you?
Yes.
Okay, so let's proceed to look the arm bands. So this one. So we're doing this to make sure you have the right patient. Then test our patient to see if they know who they are, their date of birth, and ask them some other question to assess their neural status. So, say your first name and last name.
My first name is Sam and my last name is Cortes.
Okay, so how about your date of birth?
February 20, 2004.
Okay. Do you want me to call you Sam or Sir Sam?
Just Sam.
And can you tell me where you at?
I'm at the hospital.
Okay, very alert. And can you tell me what are we doing here today?
We are going to perform an head-to-toe assessment.
Okay, so he answered all those questions correctly and he's alert. He's oriented times 4, so we can chart alert more than times 4. So, we're going to collect now the vital signs. After collecting the vital signs, we're going to check the pain rating of the patient. So, Sam, are you having any pain on scale 0, no pain at all, and 10, the worst pain you've ever had?
0, no pain at all.
Okay. So, we're going now to inspect first the head and then down to the toe. So we're going to check if there is any abnormality on the skin, if the skin color is normal, or if you can see any lesions. So far the skin is normal, and then we're going to check also the head if it matches the size of the body. So yes, it is. It's normal also. And then we're going to check if there is abnormality in the face, if there is any twitching like involuntary control. So we can clearly see that there is none. And then lastly, we're going to check the symmetry of the face, if there is any dripping of the other sides, like so. We can see there is none. And now we're gonna go ahead and look at the facial expressions and tests. Cranial nerve 7, which is the facial nerve. So, can you close your eyes tightly for me and open them up? Okay. Now smile. Frown. Pop out your cheeks. Okay. So we did that with no difficulties. So meaning, the cranial nerve is intact. So next we're going to do is we're going to palpate the head. We're going to check for any masses identifications, look for skin breakdown infestations, and for this part I like to wear gloves. So yes, let me wear some gloves. Look at the hair, feeling for any masses, indentations, and looking for any skin breakdown. Next, also check the back of the head. So we're going to check the back of the head here. If there is any breakdown, so there is none. And also, while doing that, look inside the hair and make sure there's no infestations like lice, no abrupt like rounding areas of baldness which could present alopecia. So there is none. So his hair is clean. So let's remove gloves and perform hand hygiene. And now, find the temporal artery and palpate bilaterally. So here, test cranial nerve number 5, which is the trigeminal nerve. So Sam, can you clench your teeth like bite down for me? And feel the masseter muscle, which is right here. And then feel the temporal muscle. And then to also test the nerve, try to open his mouth against resistance. Try to do that for me, Sam. Okay, you can do that. And fine, let's find the temporal mandibular joint. So it's here. So open and close your mouth. Open. Okay, so to feel for any grading or clicking sensation, so I feel none. And let's palpate the sinuses and put pressure on 2 sinuses. So let's put it here. So do you feel any pain? None. Okay, how about here? The frontal? Can you feel any pain? Okay. And now we're going to assess the eyes. So let's look at the eyelid, the sclera, the white of the eye, the iris, the pupil, and the conjunctiva. So it should not have any swelling in the eyelids, and also the sclera should be white, not shiny like yellow, the jaundice. And the conjunctiva, when you pull it down, the lower lid, it have the patient look up, and it should be pink, not red, and it should have no drainage. And look at the eye, how do they set in the eye socket, if the eye is fit, and are they equal? Is there any strabismus, and is there a cross eye where one eye turns in, out, or up and down? So okay, these eyes are normal, there's no strabismus. And next we're looking at anisocoria, where one pupil would be smaller. So the patient eye is they are equal, so they are normal. Looking at cranial nerve 3, which is the oculomotor, cranial nerve 4, which is the trochlear, and then cranial nerve 6, which is the abducens. First, look for any involuntary shaking of the eye. And then take the pin light and hold it about 12 to 14 inches away from the patient's nose. So what you have to do is keep your head still, don't move your head, and just use your eyes to watch where I move the pin light. Okay, 1. Okay. So let's look if how reactive the pupil is. So we're going to shine the pupil using our pen light. So Sam, can you stare on the wall for me? Then, okay, another one. Then let's check for any accommodation. So Sam, stare off in the distance please, and I don't want you to move your head or anything. Just keep it still and just follow his spin. Okay, so he can do that as well. So now we can document because we just check all of the things with the eyes. So pupils are equal, round, also reactive to light, and the accommodate. And now we're done with the eye assessment. Now let's proceed to the ear assessment. So let's inspect outside of the ears for any abnormalities, redness, drainage, and such. So are you having any pain in the ears?
No.
Okay. Check for any masses that can be found under the helix of the ears, as it can be atrophy. So as you can see, there is none. And then let's also check the mastoid process of the patient if there's any redness. And let's palpate if there's any lesions. Does this hurt?
No.
Okay. There's no tenderness or pain. Then next, let's palpate the ear and just move it around and ask if there's any tenderness. Do you feel any tenderness?
None at all.
Okay. Then let's move this target a little bit and ask if it's hurt. How about this one? Do you feel any pain?
No.
Okay, there's no pain or tenderness. Then next is we're going to check the cranial nerve number 8, which is the vestibulocochlear nerve. So let's occlude one ear and let's whisper 2 words on the other side and tell me what I said.
Lemon orange. Lion giraffe.
Okay, so as you can see, there's no defect of the ears and he can hear properly. So we're done with the ear assessment. Now let's proceed to the nose. So first, let's inspect the nose and let's make sure it is aligned on the midline of the face. So yes, that it's aligned. Then let's look up on the septum if it's deviated. So it's not deviated. And then, are you having trouble with your nose
None at all.
or in drainage?
No.
Okay, so now let's check the patency of the nose by including one side of the nose, breathe in and out, vice versa. Okay, the first one, breathe in, breathe out, and the other one, breathe in, breathe out. Okay, good airflow. So we do this to detect full lips that can block airflow. The next, let's get a pen light and look inside the nose. Let's look for any drainage, redness, tenderness, full lips, and anything like that. So now let's see. So everything looks clear and nice. And now let's check the cranial nerve number 1, the olfactory nerve. So close your eyes and I'll put something in front of your nose. Breathe in and smell. Breathe in and smell. Okay. What does it smells?
Smell like mint.
Yes, this is a mint. It is a mint for the nose. Then his cranial nerve is intact. So we're done assessing the ear, and now let's proceed to the neck assessment. So to check the neck, let the patient extend his neck and check the trachea if it's in the midline, and assess if there is abnormalities like lesions and lumps. Okay, since there is no abnormalities, the neck of the patient is normal. And now we will assess the accessory nerve, cranial nerve number 11, by letting the patient move his head side by side. Okay, up and down. And shrug against resistance. Okay, since the patient was able to do it with ease, the cranial nerve is intact. Now position the patient at 45 degrees and 45 degrees, and let him move his head aside and inspect for the jugular vein. And now we're looking for any distinction of the vein here. Okay, and I do not see any. And now we're gonna do is palpate the trachea to confirm if it's in the midline trachea, and ask, do you feel any tenderness?
No, none at all.
Okay, I do not feel also any lumps. And the next one is we're going to palpate the lymph nodes. Here, so the next thing we're going to do is we're going to palpate the lymph nodes. So we're going to start at the preauricular in the front of the ears. So here. The next at the postauricular at the back of the ears. Next, we're going to the occipital. Then the parotid. Then the jugular digastric. Submandibular, submantle, then the superficial cervical, then in the deep cervical chain. Can you feel any tenderness?
No, none at all.
Okay. Now the posterior cervical, supraclavicular. Okay. Since the patient does not feel any tenderness, the neck of the patient is normal. And now, next is we're going to palpate the carotid artery. So we will not palpate it bilaterally, it needs to be palpated individually. So let's palpate it side by side with same strand, 2+, okay? Okay. Lastly, we're going to auscultate the carotid artery one side at a time. So we will listen with the bell and listen for any bruit sounds. Breathe in, breathe out. Okay, up for me, hold it for me. Did not hear any side. Did not hear in this side. Next, breathe in, breathe out. Okay, hold it for me. Did not hear any bruised sounds. So all in all, the neck of the patient is normal. There's no tenderness, lesions, or lumps. And also, in the carotid artery, I did not hear any bruised sounds. So the next assessment we will do is the upper extremity. So we're going to inspect the extremities if there are any lesions, tenderness, swelling, and it is also a good time to check if there is an IV connected or any central line. Then we're going to palpate the pulse or the radial artery. So we should palpate it bilaterally. So can you do this? So it should be, put your index finger and your middle finger here and push not so hard so you can feel the pulse. So okay. Then after, let's check the capillary refill. So let's press the nail bed and see how fast it comes back. And it's less than 2 seconds. Then okay. It should be like this. So press the nail. Okay, it's normal. And then we're going to check the. Then next we're going to check the skin turgor So we should pinch the skin and see how fast it comes back. So it's good. Then next, we're going to check the joints of the hands and look at the range of motion. Let's look if it's normal or there are any symptoms of Bouchard's nodes or Heberden nodes. So let's look at his hands if it's normal or if there is any symptoms. So see, it looks normal. And then let's ask the patient if his hand hurts. So does your hand hurts?
No.
So let's palpate the brachial artery located in the side bends of the arms because there is another pulse site here. Here. Both. Here. Use your index finger, middle finger, and push a little bit hard so you can feel the pulse. So I can hear it. I can feel it also. Okay. So next we're going to check the muscle strength. Okay, so squeeze my fingers as hard as you can. Okay, it's pretty hard. And another is that push against my arms, and I'm gonna push my arms towards. Okay, very good. 5 plus normal strength. So next we're going to test the arms. Move the arms if you feel any gradient pressures or joints or arthritis. So let's move that bilaterally. Okay, here. Next. Okay. After, we're going to hold up their arms. Hold up their arms and like this. Close their eyes for about 10 seconds. And let's look for any drift like this. Like this. Like the arms will be going upward. And let's assess the hands if it will drift upward a lot of times because this shows the patient has a stroke. So 10 seconds. Okay, there's no symptoms of the arms. And then next, so the next thing we're going to assess is the chest. So inspect the chest, then we're looking for any abnormalities like lesions or wounds, anything like that. And also we're going to inspect the patient's efforts of breathing. Is it really labored or are they really using those accessory muscles to breathe? And then we're looking for the anterior and posterior diameter. So turn to the side. Look for the barrel chest. Okay, it's normal. There's no any abnormalities in the chest. So the next is we're going to listen to heart and lung sounds. And then we're going to auscultate heart sounds and do this on the 5 locations, and they're based on where the valves are located. So always remember the mnemonic. All patients effectively take medicine. So aortic, pulmonic, Erb's point, tricuspid, and mitral apical pulse. So using the diaphragm, this one, we're going to listen to the second intercostal space, and that's going to be the aortic. So from here to the second intercostal space, which is here. Listen here, the aortic. We're just listening to the lambda, the S1 and S2, and always remember that the S2 is going to be the louder in this location. And then we're going to go a little bit over the left valve is found on the left intercostal space. Then we're going now to the third point. So here, the loudest sound in this location is the dub. The next, we're going to the third location, which is the herbs point. And again, here, for love dub, there's no specific valve here. So from here to second, let's go down here. Okay, then down to the fourth intercostal space of tricuspid valve. And love will be the loudest in this location. So from here, let's go down. The next, last but not the least, the fifth intercostal space. We're going to check the mitral valve, and love is the loudest in this location. Another, there is something special in this side because you're going to listen in full 1 minute of the apical pulse. So the normal apical pulse should be 60 to 100 beats per minute. So it's located here. After checking the 5 valves and check the heart sounds, we're going to switch the stethoscope into the belt and repeat the locations. We're going to listen for the heart murmurs, for the heart if there is any murmurs, swishing, and blowing sounds. So first here. Next. And that's how you assess the chest. So the next assessment will be the lungs. So while listening to lung sounds, we're listening for abnormal sounds like crackles, wheezes, pleural friction rub, and stridor. So first, we're going to listen entirely, and what we're going to do is listen to the diaphragm or the stethoscope and start of the apex of the lungs. Then let's compare both sides and enter way downward and assess all the lobes of right and left lung. Okay. So let the patient breathe in and breathe out and inspect the apex. Okay, breathe in and breathe out. Breathe in, breathe out. And then after the apex, we're going to the second intercostal space. This part helps us to assess the right and left upper lobe. And then we're going to fourth intercostal space and assess the right middle lobe and left upper lobe. Here. And then we're going to mid-axillary in the sixth intercostal space and listen to left and right lower lobe. Then let's go back. Let's go back. Again, just repeat to the apex and mark your way down in assessing. So while listening at the back, we have the scapula. And then we're still going to compare sides. So we're going to check first the apex. Breathe in, breathe out. Breathe in, breathe out. Next, breathe in. So in this part, we're going to find the C7, which is the vertebral prominence, the big ball here, and we're going down a bit to the T3, and between shoulder blades and the spine here. Assess the right and left upper lobes. After, let's listen to the right and left lower lobes. So here from the apex, let's go to the second intercostal and then the left and upper lobes and the right and lower lobes. Breathe in, breathe out. Breathe in, breathe out. According to the breathe in, breathe out. 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 The other side. Breathe in, breathe out. Okay, that's how you assess the lung sounds.
For the next assessment, we'll be doing the abdomen. Now we're going to assess the abdomen, and always remember we will sequence on how we assess. So first, let's go to inspection, auscultation, percussion, and palpation. When assessing, have the patient lay on their back, then let's inspect the abdomen. But I'm gonna ask Sam, are you having stomach issues at all?
No,
When was your last bowel movement?
a while ago.
Okay. How are you urinating? Do you have any pain when you're peeing, or do you have problems on stream and any discharge, anything like that?
No, nothing at all.
Okay. In your male patients, you wanna ask about that due to prostate enlargement. It's starting to stream, and in female, I'm gonna ask about her menstruation and again, her urinating and things like that. Okay. So we're inspecting abdominal contour, and this patient is coughing. It goes a little bit in, and also check for any masses if we do see any hernias or anything like that. Also, check if your patients have any wounds. Check for the stool. Note the smell if the bag needs to be changed. Now, we're ready to check the bowel sounds. What we're gonna do is to listen at the diaphragm of the stethoscope and start at the right lower quadrant and work away clockwise, and we will listen to all 4 quadrants, and we should hear 5 to 30 sounds per minute. And if you don't hear any bowel sounds, you need to listen for 5 full minutes. Note if it's normal, hyperactive, and hypoactive. So first quadrant. Okay, none. Second. So after listening to the bowel sounds, then we're going to listen to vascular sounds and do this at the bell of your stethoscope. And we're gonna listen to aortic, renal artery, iliac artery, and you could also listen to femoral artery if you need it. So let's listen to aorta artery, and it's a little bit lower on the seafood process and a little bit above the umbilicus, and we were listening to blowing and swishing sound that would represent to a brew. Okay, here. Okay, none. It's noted. And then we're gonna listen to left and right renal artery. So here's the right. Okay, none. Noted. Then over the left. Okay, none. Noted. Then we're gonna listen to the iliac, and it's a little bit below the belly button. So here's the iliac. Okay, the other side. Okay, good. So the next thing is palpation. We're gonna do is a light palpation, then deep. Then please tell me if you feel any tenderness or any pain. Then start in the right lower quadrant and go for about 2 cm and feel for any rigidity, any lumps, masses, and such. How does it feel?
It's fine.
Okay. Now, we're going to a deep palpation, and I'm gonna go for about 4 to 5 centimeters using my 2 hands. We will feel for any masses, lumps, or any tenderness, and tell me if you feel pain. You feel pain?
No, nothing at all.
Okay, good.
So the next thing we're going to assess is the lower extremities. So first, we're going to inspect the legs and toes and look for the color. Make sure it's nice and pink, and also look for the hair growth. Also, do you see any abnormal swelling just right off the moment before you touch? And the patient, and look at the legs and the feet for any swelling or redness. So there's none. Okay, Sam, do you have any pain in your legs or anything like that?
No, not at all.
Okay, so and looking at the joints, make sure there's no redness on joints because a lot of times with gout. And make sure that everything looks good. And also, look at the feet if there is any fungus or there are missing toenails, so assess for that. And next is you're gonna palpate the pulses and palpate your pulses behind the knee. So here, so those are 2+. Okay, feel the legs if it's nice and warm. It's good. Push the tibia firmly and see if there is any edema. Okay, you don't have any. Next is we're gonna palpate on the feet and feel on the pulses. And use gloves. But before performing, first perform hand hygiene. And now, feel the pause on the feet, and we're gonna feel on the posterior tibia. So here. Okay, 2 plus, really good. And then we're gonna feel the dorsalis pedis, which is on top of the foot. Okay, 2 plus with that. And next, we're gonna check the capillary refill of his toes, just like how we did with the fingers by pushing down. And in less than 2 seconds, check the other one. Okay, now I'm going to have him push against my hands. Okay, good job. Now I'm going to have you raise your legs against your resistance. Okay, the other one. Okay, good job. And now we're going to check the Babinski reflex. And use your finger if you don't have any hammer. So, this will test, I will tickle your feet. Okay, and that was normal. So, that is how you will assess the lower extremities. So, the last but not the least assessment is the back assessment. So when assessing the back, we're gonna look at look at the head, this, down, ahead, and if you really want to pay attention to any abnormal mole lesions, wounds, and anything like that, you're gonna check it from the head down to here. So from his back, there's none, as you can see. It's normal. There's no abnormal lesions, lumps, wounds, swelling, or tenderness. So all in all, his back is good.